For anyone who's ever felt discomfort on the outside of their bodies, visceral manipulation is actually a very important way of proceeding into overcoming the symptoms. What many people don't realize is that a large percentage of the symptoms we feel on the outside of our body are in fact driven from the inside of our body. Neurologically, we're not wired to feel our organs, and this is where visceral manipulation comes into. It's one of the tools that an osteopathic practitioner will use. And what we're looking for is the reason for the symptoms on the outside of the body if they're generated from inside the body. For example, if your liver and gallbladder are in fact becoming mildly pathological, what will first show up, first and foremost, is in fact your right shoulder will start to ache. People will start to get a stiff, achy shoulder with some referral back up into the neck. That's the symptom. The problem is in fact the position, possibly, or the toxicology of the liver and the gallbladder. And visceral manipulation actually teaches us and allows me to go in and drain the gallbladder manually, very gently, and reposition the liver. Keep in mind, all the organs in the body, in your body, are in fact hung inside a web of what's called fascia. This fascia is complete throughout the entire body. Any injuries to you, surgeries, infections, and in some cases even emotional traumas will distort that fascia. And when the fascia pulls and twists, it then moves an organ somewhere out of alignment. When these organs, of course, move out of alignment, we're now restricting the blood flow into the organ as well as out of the organ. And importantly, we're also now possibly impeding some of the lymphatic drainage. And that's where you get rid of a lot of your toxins out of the organs. When this happens, in the subtle times, you'll feel a bit of pain on the outside of your body. If left unchecked, this will then develop in, or can develop into, a disease state. At that point, osteopathic manual medicine may not help you. You may need to go to an allopath at that point. Before that happens, though, we're trained to actually go in and reposition the organs gently by using very, very subtle forces to gently move the organs back into place, keeping in mind that the body has an innate wisdom in it that wants to go to a place of balance. And as a practitioner, I don't actually have to move the organ. I suggest where it needs to be, and the body's wisdom will take over and adhere to that new balance.